And I think that if people don't have an advocate to fight side by side with them through this process against their insurance companies or work or whatever, it's almost impossible to navigate all of that. And that itself is such a tremendous stress.
I think that's a very good point. So one of the things we do as disability insurance attorneys is when we get involved, we completely remove the clients from having any communication with insurance companies. And so we act as a buffer between our clients and insurance companies. Insurance companies are not permitted to contact them. You can't show up at their house. You can't schedule them for these so-called independent medical evaluations by insurance company doctors. There's a new sheriff in town, essentially.
You guys provide a ton of value for our patients. But what you just said, I think even more valuable than an award itself. And I'll tell you why. Because our patients don't have the bandwidth to go against Goliath, period. Welcome to the Hope and Help podcast, where we talk about science and science-based tools for fatigue and chronic illness. I'm Haylie Pomroy, your host. I'm a #1 New York Times best-selling author, and I was the former director of the integrative medicine program here at the Institute for Neuro-Immune Medicine. I say former because you guys, just like you, I am a lifelong learner, and I have decided to go back to school. So I'm currently getting my PhD in neuroimmunology here at the Institute. When I was looking for a PhD program, I thought that there is no better place in the entire world to study the impact of inflammation, of neuroinflammation, and of what the heck we've got going on in chronic disease. So today we're going to talk about disability and disability insurance. I have a very special guest joining me. He is the founding attorney of Dabdoub Law Firm. They specialize in disability insurance, and this is Eddie Dabdoub. Thank you, Eddie, so much for being here with me today. I really appreciate it. Our community, I think, needs this conversation.
I'm happy to be here. Thank you.
Absolutely. So you are also an ERISA, ERISA attorney. What does that mean?
Well, so ERISA is the area of federal law that applies to the overwhelming majority of disability insurance claims. And that's a question I get asked a lot, right? Even from attorneys. Because ERISA, although it's this huge comprehensive statute that applies to the majority of insurance that working class Americans have, right? So about 80% of Americans have insurance, health insurance, or disability insurance that's governed by ERISA, this statute. Nobody's ever heard of it.
Right. I hadn't heard of it, and I'm in this space. So it's governed. Is it for long-term disability or is it for chronic illness?
It's for all types of insurance.
Okay.
So it would cover health insurance, life insurance, and definitely disability insurance. So when somebody has a disability insurance claim, the laws that apply are the ERISA laws.
Wow. Okay. This is something that I'm learning a lot, always, every podcast, but this is one I think that's critical for our community. So I'm going to take a couple steps back first. In our practice, we deal with a lot of individuals that have ME/CFS, POTS, environmental illness, Gulf War illness, a lot of different neuroinflammatory disorders, things like Parkinson's, ALS, viral reactivation, long COVID. We're seeing a ton of that right now. So many of our patients come through the door and so many individuals in our community that are feeling extremely hopeless and don't realize that there are actual laws that can help them. Shed a little light on that for me. Give me kind of in pencils and crayons, talk to me like a third grader. What's available or accessible to individuals that are struggling like this?
Right. So all those illnesses, diseases that you've mentioned, I've represented clients suffering from all of them, and there tends to be a shared sense of hopelessness when somebody has to stop working initially, right? Like you get a sense that these people, my clients, they feel like they've lost a part of themselves.
Well, most of them, or a lot of them at least, that have come through our clinic, there's a lot of highly functional type A mover and shakers, right? And they're just in a state of shock that they're in the state of health that they're in.
That's exactly right. And it seems like there's this mourning period where they've lost their occupation or part of their identity. And so there's a transition process. But, back to ERISA for a second here, because I should define what ERISA is. It's an acronym that stands for Employee Retirement Income Security Act. It was passed by the U.S. Congress in 1974.
Wow. Okay.
Yeah, so it's been around for a while. And Congress passed it, I think, mostly with good intentions of telling insurance companies, look, we'll pass this comprehensive statute that creates this legal framework for insurance claims, and we want insurance companies to go out there and issue more insurance policies, go provide more health insurance and more disability insurance and other types of benefits to employees. The stated goal in the statute itself is that it is for the benefit of employees and their beneficiaries, the beneficiaries of these insurance plans. What I have seen since ERISA was passed in 1974 is an evolution of an area of federal law that isn't necessarily friendly to the disabled, right? And so now we're operating in an environment where people are. It's now truly a David versus Goliath situation where folks who are
there's
struggling,
so much money involved with the insurance companies.
And the insurance companies have deep pockets.
Yes.
They understand ERISA. They know how to use the laws.
And so many lawyers don't. We've talked, so many lawyers. You have to be really, really savvy in disability claims for individuals like our patients, in my opinion, in order to navigate, I don't want to say against, but navigate in the arena with the insurance companies.
That's completely true. If you think about it, there are thousands of personal injury attorneys in any given state.
Right.
There are probably only a couple hundred attorneys in the country that specialize in disability insurance like my firm does. So
it leads me to my perfect question. Why in the world do you do this type of law? Because I'll just tell you, being a patient advocate and being in, I have an autoimmune disorder. I also have a learning disability. Being fought and won LA Unified School District on behalf of my child. Being in that space of chronic illness with autoimmune, I have very healthy. But finding attorneys that had any, not to mention as versed as your firm is, but any knowledge of this stuff was crazy, and I was in LA. So there has why are you doing this type of law? What motivated you?
So I to be very candid, I fell into it, right? In my second year of law school, I took up a job as a law clerk, just looking for experience. I didn't know what I wanted to do as an attorney, and it just so happened I ended up taking a law clerkship at a firm that had disability insurance cases, and that's what they were doing at the time. And I started working on these cases, and I found it very different, very interesting. And one of the things I was really struck by is, as I learned about ERISA, which, by the way, they don't teach about ERISA in most law schools.
So my niece is at USC, and I had that conversation with her in preparation for this, and she said, Auntie, I don't even
never heard of it.
Next subject,
exactly. And you would think that federal law that touches 80% of working class Americans would be at the top of the law school list.
Yes,
for classes.
But there might be people that want to bury it for a reason.
Perhaps.
I'm just saying.
Yeah, maybe. Yeah. And so I started working on these cases, and what I found really interesting was here you have a certain segment of the population, a really vulnerable segment of the population where they're struggling.
They don't feel good.
They can't handle day-to-day stuff, much less navigate a disability insurance claim, where on the other side of it, you have a savvy insurance company that's not really looking out for their best interests. Right. And looking at that dynamics, and then understanding that ERISA was passed with good intentions, but then looking at how the law is today, I was struck that in the United States, we had that structure.
There's a shocking dichotomy. There's a shocking difference between, or chasm, a gap between the people that need the help and the ability to get the help, right?
That's true.
Yeah. I mean, I was shocked. Just, I mean, if I slipped and fell at a mall, right, in LA, there's a poster for everyone that has possibly slipped and fallen at a mall to find legal support.
Yeah, I mean, absolutely, there is. And I've been doing this for almost 20 years, and I'll tell you that I feel like I learn and hear something new and shocking every day. I'll share with you on the car ride up, one of the attorneys from my firm called me and said, this might be a new law. We just got a call from a potential client who has a severe illness and his disability insurance claim was denied. I said, okay, that's not a shocker to me. What's the shocker? She said, he's the guy in charge of nuclear reactors. Yeah.
Wow.
And he, among all the physical conditions he's suffering from severe anxiety.
Wow.
And the insurance company essentially denied his claim, saying, no, actually, we think you can continue doing that job.
Yeah.
So
yeah, we think you'll be okay.
Yeah.
Just do a little stress reduction.
Shake it off.
Yeah, knuckle down and shake it off. Hey guys, it's Haylie Pomroy, your host. Right about now, you're probably struggling to achieve the health that you deserve, and you're just not sure what you need to do in order to get it. So what I've done is I've created a special link for you that will give you the nutrition and supplement programs that I use in my private practice to achieve amazing results for my clients and my community. Go to HayliePomroy.com/podcast. Plus, when you use that link, you'll get a 20% discount just because I love you. Again, that's HayliePomroy.com/podcast. Now, back to the episode. Share with me some other situations. We hear, we have individuals that, I was just out of the country at a Congress for autoimmune disorders in Slovenia. And there were doctors, the doctor that discovered the antibody for lupus, and just phenomenal, well-researched, just incredible, brilliant people. And I was sharing with him that in the United States, so many of our patients struggle with getting disability insurance, and they were floored. And I know there's socialized medicine in a lot of the countries that I was talking, a lot of the doctors I was talking to in those countries, they can't even fathom it. They can't even wrap their heads around it. And it is so common. Most of the people that come to your offices, what types of chronic illnesses are they dealing with?
I see it all.
Okay.
I have run into medical conditions I did not know exist, but everything from Parkinson's. We definitely see a lot of long COVID more recently, obviously. I've been handling ME/CFS claims.
So you're already seeing long COVID?
Yeah, we see a fair amount. We actually just ended up wrapping up a case for a young lady. I can't divulge details that would identify her because of the attorney-client privilege, but I can say that she was 26 and her situation was so bad that she got married. She when she got married, she was in a wheelchair in her wedding gown, and all of her wedding photos had her in that wheelchair. And to me, that was more powerful evidence than just about anything else I could send an insurance company. Why would anyone in their right mind
deny those claims?
Right, and yet her claim was denied, and we had to litigate that case.
Wow. Mm-hmm. Oh. Well, thank you for doing that on her behalf, on her family's behalf, on her husband's behalf. That's a worthy fight.
It's certainly motivating, that's for sure. The way we handle a case like that is we show, look, she's either a complete liar, her doctors are liars, her in-laws, her husband, they're all in this fake disability case. Or you just have to accept that some people can actually be disabled from chronic illnesses.
Yes. Absolutely.
You have to polarize it.
Yeah. But it's just terrible that a person would have to go to those lengths. How do people, do people need to wait to a certain point before contacting your office? Because I'm an info seeker just by nature, right? So when I started to have a problem, I started calling and talking and investigating. People talk about ready, aim, fire. I'm a ready, fire, aim, right? I seek knowledge and then I pivot if it's not right, no judgment, and I pivot if it is, I lean in if it is right. At what point in people's cases do you encourage them to contact your office?
I don't think it's ever too soon, right? People sometimes get intimidated calling an attorney's office.
Right.
And for us, it's just, reach out to us. We have 8 attorneys. We all specialize in disability insurance, and all of us, we all dedicate some amount of our time in just talking to people.
Right.
There's not a week that go by I don't speak to 3-4 new folks. Just 1 hour at a time, imparting as much information as they need. And maybe at some point they're going to need an attorney, but certainly there's no harm in having information up front.
Be empowered.
Exactly.
Right. And our goal is to get people on the journey to being well. Right. And we have hope for every person that walks in. Dr. Harris the other day said, 20 doctors in 10 years before they finally land in our institute. Clima says, I believe everybody that walks through our doors can get well. But one of the problems is Dr. Junco was just talking in another interview about how stress is such a deterrent for getting well. And I think that if people don't have an advocate to fight side by side with them through this process against their insurance companies or work or whatever, it's almost impossible to navigate all of that. And that itself is such a tremendous stress.
Yeah, I think that's a very good point. So one of the things we do as disability insurance attorneys is when we get involved, we completely remove the clients from having any communication with insurance companies. And so we act as a buffer between our clients and insurance companies. Insurance companies are not permitted to contact them. You can't show up at their house. You can't schedule them for these so-called independent medical evaluations by insurance company doctors. There's a new sheriff in town, essentially. And so the idea is that...
I want to stop you just for a second, because what you said is, you guys provide a ton of value for our patients. But what you just said is, I think, even more valuable than an award itself. And I'll tell you why. Because our patients don't have the bandwidth to go against Goliath, right? Period. They don't have the bandwidth oftentimes, as you know, to exercise, to get up and be at work, let alone to go through. And we have people that come in, our patients and our clients that come in and talk to us about how derogatory or how negative of an impact some of those independent medical exams are. People that have told them you don't have a problem right to their faces.
Yeah.
And these are people that would give anything. There's not an award big enough. They'd trade any award. I haven't had one in my 30 years of practice that hasn't said I would trade the award for never having to go through what I'm going through 10 times over. Right?
Exactly.
So that, I didn't mean to stop you, but I just I don't know if you know, but from the patient perspective, the impact of you creating that buffer for them gives us as practitioner a patient to actually work with. And that's really important to us.
Well, and that's wonderful, because we all know how much stress impacts chronic illnesses.
Absolutely.
Right? And it exacerbates it, it makes it worse, and it's counterproductive. Just today, I had a conversation with a client, and she has a chronic illness, and we got to a point where we've negotiated a good settlement with the insurance company, and I had to speak with her about what her options were. And do you take a pretty decent settlement and get this monkey off your back and move on with your life and get rid of the stress? Or do you want me to continue fighting them and take this case all the way? And she decided it wasn't worth it. Right. She wanted the settlement. She wanted her life back. And that sometimes is a right decision for some people.
And also resources to be able to invest in your health.
Yeah.
Because a lot of really good medicine, a lot of people are paying out of pocket for it. Yeah. We see it all the time. We try really, we have a sliding scale at the Institute. That's why we have a year plus waiting lists, right?
Right.
But we see individuals that go out for even nutritional IVs or even acupuncture. We have that in-house, but they go outwards and they're paying cash out of pocket for it. And it's making a massive impact in their health. But where are they going to have those financial resources to infuse into their health when they're fighting? Just the time that it takes to fight an insurance company. I don't know. We went through it, so I'm a little bit, probably have a little bit of a still sting, I guess I would say. We had a great attorney, and I consider this person was probably the biggest advocate our family's ever had. Hey guys, it's Haylie, your host. I wanted to bring to your attention the possibility of coming in and doing a study with us. It is called the COVID UP study. And UP stands for Understanding the Post-Viral Phase. You have to be local in South Florida. There are 2 phases of this study. Let me give you the phone number. It's 305-275-5450. And the email is inimresearch@nova.edu. We are currently looking for patients that are dealing with post-COVID, long COVID. We have 2 phases of that study. please contact us and see if this could be an opportunity for you to get the care and information that you need.
Hola, soy la doctora Ana Palacio, de la Universidad de Miami. Me encantó participar en el podcast de hoy y quería invitarlos a considerar el estudio COVID Up. Este estudio está tratando de determinar por qué las personas no mejoran después de COVID. Si les interesa saber más de este estudio, por favor llamen al número 305-275-5450 o pueden escribir al email inimresearch@nova.edu. Les agradezco mucho su interés y nos vemos la próxima vez.
Your toll-free number is 888-812-0393. And then you have, what I love is you have a digital handout, right? That people can just kind of get information from. Is it like a questionnaire? Right. Is it facts? Is it?
Yeah, so we had put together several booklets, basic information on a handful of some of the more common chronic illnesses that we've seen. And it's really just a nuts and bolts on what to know if you have one of these chronic illnesses. So we have a long COVID, we have ME/CFS, Parkinson's, we have a handful of others. And it's basically, what do you need to know if you are suffering from these illnesses and you have a disability insurance claim, or you are considering submitting a disability insurance claim? And we've broken it down, really removing all of the legal jargon and making it just easy to understand by the average person.
No, I appreciate that, because you can get so buried in kind of the legalese or the legal. You talk to me about neuroimmunology and we can talk all day long, but you start talking about that other stuff and it just goes over. So they can download these at longtermdisability.net, longtermdisability.net. So you guys, please go and grab the handouts, because we really encourage our patients early in the process to understand if it's even an option. And I was talking to someone in business development the other day, and they said, I was there with another individual that runs this great business, and they say, are you running your business to sell your business, or are you running your business to keep your business? And they said, well, probably to keep my business. And they said, well, the odds are it's going to fail because you're not running it to sell it. So you're not running it for someone, for it to be under the constraints of having to perform. You're running it because you enjoy it. So it's probably, statistically, it's probably not going to be successful. I use the same analogy we always encourage our community that knowledge is power. And so whether you are thinking about that you're going to need to file a disability claim, or that's part of your journey towards health, having the knowledge or running your life as if can only make you more successful if you don't need to, right?
Right.
So I appreciate that you guys do the conversations with our clients, and that's why I wanted to bring you on, is so that our community could have access to you. Our patients have had such tremendous relief and tremendous support from your firm, but I think that our community is really out there struggling. And so I appreciate you coming in and coming on. I just want to, so for all the people, 2 questions. How did you start engaging? How did we start engaging with you from the Institute of Neuro-Immune Medicine? How did you start working with us specifically?
I might have only been 1 year out of law school, and I had a really interesting case. I was representing an attorney, and Dr. Kaiwas was the treating physician.
Doctor, really?
And that's how we ended up connecting. And then subsequent to that case, I had a few cases with Dr. Ray, and Dr. Ray was so passionate about helping her patients.
Yeah.
I just couldn't help but reach out to her, and we've connected. We've stayed connected. She's extraordinarily busy, as you know. I'm happy for her, and I'm sad for especially with long COVID now.
I mean, all of our ME/CFS, our neurologists, our immunologists, when it started coming, they all saw this happening. I mean, I asked the head of one of our leading advocacy groups, I said, did you guys see this coming? And they said, absolutely, absolutely. And when I was traveling with all the immunologists a couple of weeks ago, they all said, this is the pandemic. Mm-hmm. The long COVID's the pandemic.
Yeah,
it's crazy.
Well, And you know what's funny? I would have thought, and I'm no medical expert, but I think I know a thing or two about chronic illnesses. I would have thought I would have slowly seen a dying out of long COVID claims on the insurance side.
Yeah.
It's not.
No.
It's not. It's almost going up.
Yeah.
So it's definitely something's going on out there. Now, what's interesting to me, we spoke a lot about the expertise, right, that you guys have, and the wonderful physicians and the team.
We're very lucky.
Indeed. And juxtapose that to who the insurance companies are using
Right.
to review these disability
Right.
claims. These physicians and nurses that are reviewing the claims or examining my clients sometimes have no training, education, or experience. They are not equipped to be handling these types of claims.
Even rendering an opinion.
No, they have no business rendering an opinion. But I sometimes wonder if the insurance companies don't do that
Oh,
purposely.
of course.
Because they could find the right doctors to look at it.
Right,
but
right. Why don't they call Dr. Ray?
They
Why
know
don't they
what
call
Dr. Ray
Thomas?
would say.
Why do they call Dr. Irina? Yeah, and or you know, Tony Kamanoff, or you know, the people that know this industry,
Absolutely.
that are very discerning. You know what I mean? They don't just feel like a person has a chronic illness. They go to great lengths to run diagnostics to help identify what's going on in these patients. I mean, the identification is so important to customize and tailor the treatment.
Mm-hmm.
No, you said that very kindly. I will flat out tell you that it behooves insurance companies to not have somebody that can identify chronic systemic inflammation, ME, CFS, long COVID. I mean, it behooves them to not have that. Help me understand, are there different types of disability, different levels of disability insurances? Like, how does that work, and where does disability support come from?
Great question, right? So in terms of disability payments, in the United States, you really have two sources. The first is Social Security disability benefits. Those are federal benefits provided to all working Americans. As long as you've paid paid into the Social Security system, taxes, whatnot, you qualify. That process takes years, unfortunately.
Years to get granted that?
Well, initially, the Social Security Administration, they deny the overwhelming majority of these cases. Okay. And then you have to go through this mandatory appeals process. And eventually, those will get approved. Okay. They just take a really long time, sometimes 2 or 3 years. I don't focus on disability insurance on the government side, but that is one option. And what we do in the firm is we coordinate to get folks who need that type of help into the hands of someone who can help them.
Got it.
In my firm, what we focus on is a second option, which is private disability insurance policies, right? Somebody has an insurance policy through work, or they've purchased it on their own, and they have to submit a claim to the insurance company.
And a lot of people don't even realize they have these policies.
Correct.
Yes. Yeah. We had a mutual that didn't have any idea that this was even an option.
Yeah.
And no one stepped up and said, "Hey, I know you've taken a lot of work off. You know, how can we?"
Absolutely true.
Yeah. Nobody stepped in and said.
Sometimes it's
Their
part
doctor
of
did.
It's part of the benefits package at work,
right?
And nobody thinks about disability until you become disabled,
right?
So it's not something you're thinking you have,
right?
So it's always worth the while to drop in an email or reaching out to HR where you work and asking for your benefits package. Take a look at what you have.
Do you help people look at their benefits package?
Yes, we can do that too.
Okay,
yeah.
and help identify if they have
disability insurance.
Okay.
Well,
okay.
And one of the good things about ERISA is if you send a written request to your employer, they are required within 30 days to respond telling you what type of insurance you have.
Oh, so people don't know that. So if let me just make sure that I understand this. If there's somebody out there and they're struggling and they're having a hard time, it doesn't hurt to just inquire?
No. Send a written request to the correct person at HR, and you should get a written response.
And what do they ask?
I would suggest, well, if you're interested in disability insurance, then just outright ask,
Okay.
Do I have disability insurance coverage? If I do, please provide me a copy of the insurance policy.
Oh, that's okay.
And by law, they are required to respond and give you that insurance policy.
See, I would never have thought to do that myself. Yeah. I appreciate that. That's a great tip.
Great. Wonderful.
I had a situation just recently. My daughter was in the hospital at UCLA. I love UCLA. I have great friends in most of the medical departments at UCLA. She had a very strange thing going on immune-wise, and they brought in infectious disease, and you know, they're phenomenal anyway, but they're overly kind to me, right? They couldn't figure something out, and I have Dr. Klimas call me on her cell phone, and we page in, we're grouping, talking, or this or that, and Dr. Klimas says, check this, and this. And sure, I was either going to fly her here to Florida or she was going to phone in. I mean, this is my baby, right? My daughter. And because she had that expertise, she was able to identify that. And again, they were kind to me because I have a relationship with them, but I could only, I don't even have to only imagine. I drove my daughter from a tiny hospital in Arizona 4 hours in the middle of the night.
To a major hospital.
To a major hospital where I have friends because of the way she and I were being treated at this tiny hospital.
Yeah.
It was like, you're 22, you're fine, you're healthy, I wouldn't even admit you. Oh no, now we're gonna do a lumbar puncture and transport you. I mean, it was so crazy.
Yeah.
And this isn't chronic. Right. So our community out there, we just had a community member. We had an in-person retreat. One of our community members was saying, she has this chronic autoimmune disorder and it's in full flare. And she said, the doctor said, I don't even really believe in that autoimmune disorder. Yeah. And I just went, we're not talking about unicorns and rainbows.
Yeah. I'm not surprised.
Yeah, no, but I was just, I appreciate that you're not surprised because you're an advocate for us.
But good thing you had Dr. Klimas's number and speed dial. But not everybody has Klimas and speed dial, right?
No,
So
and that's
the problem.
That's the inequity. And that's where you guys come in to help us bridge that gap so many times for our patients.
Correct.
Yeah, and we really genuinely appreciate that.
Well, it's been wonderful working with you guys also, right? We can't do it alone, right?
Yeah.
We're lawyers and we're not Matlock, right? So that's a fictional character. We need the treating team to provide the medical evidence and to substantiate it.
Yes.
Yeah.
But even though docs like Klimas and Rosenfeld and Reneska and Hunko that you just saw leaving here, and Dr. Ray, I mean, sometimes I wonder, they're writing letters in the middle of the nights, and they're superheroes as far as in this aspect of it. None of us can litigate, and none of us understand the law. I mean, we just can't.
Right.
Let me ask you another question. So, at what point does a person have to be out of work, like not working, before they contact you?
No, the short answer is no. I think the sooner they call me, the better. And I think preparation is key. So if they're already struggling at work, right? I like to tell people that the only person who can make a decision on whether you can't work, whether you're disabled, is you. You're the one that you wake up every day, you put your shoes on, you go through your daily routine to get yourself to work, and you're struggling. There's a point where deep down inside you cannot keep doing that. That's the point you need to call me, even if you're still employed.
Well, we have a community member that and she's got she has an amazing work community. It's not that she's a bad employer or she's in a bad environment. To the point she burned through all her vacation, all her sick pay, and then her colleagues are donating their off time, their PTOs.
Yeah, I've seen that.
Yeah, which is so cool of them because they're amazing. And I just said, we're having a conversation. I said, is there a reason why you won't entertain or talk to disability? Like, are you looking at all of your options here? How long is this going to last? How many of your friends at work really want to give up their time with their children and their family because you're not getting supported? And she just didn't even think about it.
Right.
I mean, I think she thought she was going to wait out long COVID.
And what is the human cost to her in continuing to push, especially with the nature of that illness?
Right.
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 So,
we need that bandwidth, and we need those reservoirs to change the trajectory of her health. I mean, we want them to be able to focus on their health so we can get them well. I think that's some of the gap or some of what we need you to bridge for us is to get us as much of the human being to be able to be to their appointment and to be able to execute the care so we can get that person healthy.
Right.
And I mean, we are swamped with long COVID. And it's I know that I have an opinion that our clinic, our institute, our research is super primed for it because we've been leading the charge on myalgic encephalomyelitis and chronic fatigue syndrome for so long. And one of our docs said yesterday when I was talking about having you in, she said something very interesting was, everybody said, there's such a similarity. One of our docs said, it's the same thing. It's like using the term pneumonia. Pneumonia can have many different causes. Long COVID has this neuroinflammatory response and this immune modulation problem that so does ME/CFS, right? And it has an immune component, potentially even an autoimmune trigger component. But what's causing it, like in ME/CFS, maybe it's an environmental toxin, nuclear reactor. Maybe it's environmental toxin like our Gulf War injury individuals. Maybe it's viral like Epstein-Barr virus reactivation or one of the human herpes. And maybe this is COVID virus activation.
Exactly.
Yeah. So we were prepped, right? Our practitioners were prepped. Our research was really prepped. So we have
which is wonderful for the community, right?
It is.
Yeah.
It is.
So I think it's really interesting that you bring that point up because it is true. These two conditions, I think, are pretty much the same. And I'll tell you from the legal side of things, we handle it one and the same. The way we handle these cases are the same to the insurance companies. What the insurance companies tend to sometimes do is they look at these two conditions and they say two things. One is, A, you can't prove what it is. You can't prove the label that you're giving it. And B, these are subjective symptoms for the most part. That's the argument they take. So those are two arguments we're used to receiving from insurance companies, and we know how to handle those.
But that's not the case at all in Germany, in France, in Italy,
United
in
States
Spain.
is behind on a lot of the medical things.
Right. But I think because there's more biomarkers that are coming out every day. I mean, we used to not even be able, it was not that many years ago that we could identify lupus as a specific autoimmune disorder.
Good point.
Yeah. I mean, that's really, really recent in medicine. I got to meet the guy that identified those. Fabulous. We're creating, biomarkers. Part of our research is creating biomarkers so that there's a definitive. We can say a person has high cholesterol, and the American Medical Association says if it's above 200, now I think it's 190. They keep lowering it. I wonder why. But they have this biomarker that says if this, then that.
Right.
More and more in the autoimmune world, people with lupus were told they were crazy for years. People with MS were told they were crazy for years, right?
Yeah.
Once they started to establish a biomarker, they couldn't do that anymore. They said, if this, then this diagnosis.
Yeah.
There are biomarkers that are coming every day that are unique for ME/CFS, long COVID, those types of neuroinflammatory things.
And those
then
things,
what are they going to say?
Well, those things really help on the legal side of the case. What I have noticed is over the 20 years I've been doing this, it takes the insurance companies, I think, purposely slow down accepting the medical evidence that has been coming out. Or just, it starts off with outright rejecting it. And then when it's hard to reject it anymore, they slowly come around to accepting it. Then the other problem is a lot of the federal judges have just kind of bought into the insurance company narrative on these illnesses over the years. And it takes time to untangle that. And so a lot of the times I'm in front of the judges on these cases having to educate them on what the medicine looks like.
Right. So that brings me to why it's so important for us. So we have two massive research programs right now in long COVID. And I always think of it from the treatment perspective, right? That's is we do translational research. So our goal is to bring it from the bench or the lab to bedside. How can we get treatment as quickly as possible to patients that are going to make a change in their life? You just flipped a switch, a light bulb on, which is it's critically important so that they can get the support that they need. They can get insurance. Health insurance.
Yeah.
We have individuals that because they've lost their job, they can't go to the doctors.
That's right.
Yeah. We do sliding scale.
I get that
When
question.
do you ever hear of that? When do you hear of an immunologist, a neuroimmunologist that'll take what you can give?
I know. Isn't that incredible?
But it's terrible.
It is shocking, though, that in the United States that most people lose their health insurance because they become disabled.
Right.
Isn't that when you need your health insurance the most? So I get calls from people who say, I can't keep working, but I can't stop working. I need money to put, food on the table for my kids, and I need the health insurance, and all this is tied to my job.
Yeah.
And guess what happens? They grind on and they get worse.
They get worse.
And it gets harder for them to get better when they actually eventually stop working.
Unfortunately, most of the people that walk through our office, we wish we would have saw them
sooner.
2 years, 5 years, 10 years ago.
And I would say the same thing for most of my clients. So let's go back to what we were talking about earlier. I think it's really important to contact us early.
So I'm going to give out your number one more time, 888-812-0393, and they can talk to somebody from your firm. But I think also...
Or me.
Are you? Watch it.
I'm still employed.
Eddie over here is going to spend all his time on the phone. No, we need you defending our patients. But you can, start to have the conversation. I wish we were the first stop. I wish we were the first stop. I wish we were the first stop. I mean, we all do, because we have such a mess to unravel sometimes because of the delay in individuals getting adequate care. Yeah. And I'm sure you feel that that's the same thing legally. People have maybe been out of job. We have somebody that blew through their pension. Now they own a ton of taxes, right? Because they didn't retain, because they were just thinking.
They need help.
Yeah.
Yes, you need the help on the legal side. You need, obviously, the help on the medical side. Sometimes it's really not their fault, though. What I have seen with some of my clients is, even though they've been treating with doctors, they've been bouncing around to different kinds of doctors until they find, like you guys. Right. And sometimes that's 1.5 years into not being well. Right. So it's not always their fault. I think sometimes it takes them a while to come around to realizing, wait, the doctors aren't figuring out what's going on with me. They keep referring me to other types of doctors. No one's figuring it out. And then at some point, I think they start to look into it themselves.
They become empowered. They have to. Because, we were saying the other day, we do all kinds of aspects of medicine, environmental medicine, nutrition, immunology, environmental medicine, integrative medicine, not because we think it's going to be fun for us to do, because that's what it takes to get our patients well, right? And so, but we also need support systems. They need support. And one of the things that we love about your firm is you guys do have a philosophy which is isn't as unique. Like you always say, we are more unique from a medical perspective. Is you're looking at the patient's whole well-being, and I think that's really important to us. I love your handouts. They can go to longtermdisability.net. Mm-hmm. They can download all of those. They can start looking. Our community is lifelong learners. They've had to be, not because they want to be, but because they've had to be. Right. All of our advocacy groups and stuff, I'll make sure that they have this. I would like to have you on with Dr. Ray and Dr. Klimas together and maybe look at some case studies that we can talk about that we've worked together. Can I get you to come back for our community? Absolutely. I'd love to do that. That sounds like a great idea. Yeah, I think it'd be great. I'd like to, our head of veterans, I think it'd be really good too, because I know how much work you've done for all of our individuals dealing with chronic disease. Eddie, I can't thank you enough. I know your time is extremely valuable, but I really appreciate you talking to our community. You guys, give them a call, download the information, and we are here to help individuals, but we also want to make sure that everybody has hope that there's advocacy for them, hope that there's some relief for them, and also hope that we can have a plan, right? A multifaceted plan that can get them the support they need. And we consider you a very important partner for us with that. Well, thank you. The feeling is mutual. It's been like that throughout my entire career. And I want to end by saying thank you and echoing what you're saying. Hope. Don't give up hope. Don't give up hope. There are people out there that know what to do to help you. Just reach out. Yeah. Reach out. And it's not your fault. And we're here to help. That's right. Awesome. Yeah. We'll see you soon. Thank you. Thank you.